Hello, thanks for being back with us again today. Today I'm going to talk a little bit about matters of the heart. Does COVID-19 matter to your heart? Stay tuned. You'll find out that it does, even months after an infection. Thanks for coming back. This is Dr. Oscar Hernandez, board certified internist and pediatrician. At this point in my practice, I'm starting to see a number of people who have had COVID-19. Some of them were very sick, some of them were mildly symptomatic, and some of them were just detected because we were doing surveillance testing because they were a contact of somebody who had COVID-19 and they really didn't have any symptoms. The reason that this is important has to do with your heart, among many other reasons, but today we're going to talk about the heart. Last month in July, the Journal of the American Medical Association, its cardiology journal, came out with some studies, two, one by Puntman and another one by an author, Linder. It's important to note that these studies showed that people who have had COVID-19, even if they have healthy coronary arteries, even if they're younger people who never had any known heart disease, can have involvement of the heart. And this can be seen and documented even months after their infection. This is important because when you have COVID-19 involving the heart muscle, it's probably not a very good idea to go into a very extensive workout program, or maybe if you're a very physically active person, go back to loading boxes into trucks if you work in a warehouse or other exertional work. Now, you might say, well, doc, that's ridiculous. I feel totally fine. I'm recovered. I'm going to be off this bandwagon of COVID-19 illness. This whole thing is crazy. Take a moment. And my recommendation to patients, even though there is no clear guidance from any professional organization or group or journal article that I am aware of, my recommendation is to hold off on really exertional duties for at least 2 to 3 months. And what I'm starting to do with my patients is I'm making sure that I do an EKG and an echocardiogram at 1 month, 2 months, and 3 months after their infection to make sure that there's no evidence of what we call cardiomyopathy. Cardiomyopathy is when the muscle of the heart generally starts to weaken. Sometimes we see swelling. Sometimes there's related pericarditis. Pericarditis is when the bag that the heart sits in starts to swell. All of these things can be seen after COVID-19, even if you don't have symptoms. So, why is this important, you ask? I don't have symptoms. I'm going back to loading boxes and bench pressing 500 pounds, and I'm just fine, doc. The reason is that cardiomyopathy can all of a sudden start to present itself with shortness of breath, trouble breathing, or irregular heart rhythms that could possibly be deadly from the get-go. So it's not that you had symptoms that you could anticipate that you were getting worse, and now I'm going to stop this and I'm going to go see the doctor. Here's the problem. All of this is new stuff. Remember, the citations I've just given you have to do with patients who have already left the hospital. And this is from July. We don't have that much of a history with these cases. We don't know if these people who have cardiomyopathy or swelling of the heart or any of these things are at significant increased risk of death. But we know one thing. In the hospital, there has been a significant increase of cardiovascular problems in patients with COVID-19, and some of them have had very bad outcomes. So I'm not talking now about the hospitalized group. I'm talking about people who have recovered from COVID-19 and they're out in the community doing whatever it is they do. Why do we think that COVID-19 can damage the heart? Well, in some studies, one of these studies, the first one that I mentioned, there was actually autopsy data on patients who had passed away from COVID-19. These patients had passed away from pneumonia. But when you do the autopsy and you look at the rest of their body, we know that there was involvement of the heart. There was involvement of the virus being found specifically in the heart tissue. So it's not a surprise, but it's an alarming thing when that happens. The other thing that COVID-19 does is it causes what we call a cytokine or inflammatory storm in many patients, especially those who are most affected. And an inflammatory storm causes swelling of a number of tissues, whether it's the brain, whether it's the heart, whether it's the lungs. And so swelling is generally a bad thing to have. In one sense, that's probably why many hospitalized patients are receiving steroids and dexamethasone. Now, the dexamethasone story is part of the COVID confusion. I call it the COVID confusion. And the reason we have COVID confusion going on in the scientific community is because there's a lot of stuff that we think might work, and then we study it and it doesn't work, or it does work and we said it didn't work. So this is part of the COVID confusion. Don't be frustrated out there in the general public. Give us time to sort this out scientifically, methodologically. Give us time to do this without throwing up your hands and saying they don't know what they're doing. We're all learning as we go. Now, one of the things that I depend on is for my wife to scour the lay literature, the Yahoo News and the CNNs and all these kinds of things, because I don't read that stuff generally. What am I reading? Well, I'm reading the scientific literature. Believe me, I got my hands full with all that stuff. But then she points out something that came out in the lay press. And my answer to her is always send me the article. Let me go to the source document that is being quoted in the report. And if there is no source scientific document, I generally don't pay any attention to the story. Remember, most of the stories that you see in the lay press are written by journalists who are not necessarily scientifically trained. They are not medical correspondents. They're just people who have been tapped to look at a story. Now, let's look at the title of this article from the July editorial of the Journal of the American Medical Association, Cardiology edition. I don't know if we can capture this on the camera. Look at the title. Coronavirus Disease 2019 and the Heart. Is heart failure the next chapter? Let me tell you, folks, heart failure is a serious matter. When I tell my patients that I want them to do an EKG and an echocardiogram at 1, 2, and 3 months after they have recovered, it's because I'm looking for early heart failure. Early heart failure is treatable. Cardiomyopathy from COVID-19, we don't know if that has a direct treatment at this time when we are taping this on August 26th of 2020. Next month might be a different story. But this is what I want everybody out there in the listening audience to know, that we want to make sure that if you're developing cardiomyopathy, we have a chance to identify this and treat it as best we can with things that we usually do give for heart failure before you become symptomatic and maybe before you become very sick and wind up in the hospital. Do we know for sure that that strategy will work? We don't know. This is my idea. But my eyes are glued to the literature. And again, when literature comes my way that has to do with the lay press, I look at it in detail. Which brings us to the lay press. The next thing I want to talk to you guys about today, and this is very brief, and basically, if you remember nothing else about this, just remember a simple word. No. Yeah, simple word. No. No, do not use Ivermectin to treat COVID-19 at this time. Again, this may change next month. So, my wife was noticing that in the lay press, even now, in August, we are getting articles and commentaries on certain stations that talk about a very old medicine back from the 70s called Ivermectin. Ivermectin was a great medicine. It was developed by fellows who eventually got the Nobel Prize in Physiology and Medicine in the 70s because of the discovery of this drug. Great drug, but we don't know if it really works in COVID-19. Ivermectin is a medicine that is approved by the FDA for the treatment of certain parasites and other conditions. I've used Ivermectin in patients in the past, but it has to do with treating them for parasites. Now, in the Journal of Antibiotics in April of this year, we had an article that came out of Japan. This is the one that caused the firestorm. And it is from Japan, and it comes out of Antiviral Research. This is a very trusted medical journal, and it says the FDA-approved drug ivermectin inhibits the replication of SARS-CoV-2. Here's the catch. It's the last two words, in vitro. What does this mean? Ivermectin, when we studied it to see if it kills COVID-19, did a wham-bam job. It killed a lot of virus within 48 hours. This is a very hopeful sign. But remember the words in vitro. This is petri dish stuff, right? So there's a big, huge gap and jump and leap between doing studies in vitro and doing it in human outcome studies. We know the drug is generally extremely safe, as is hydrochloroquine in most cases, by the way. We know that ivermectin is extremely safe when given for parasites. There are some contraindications, as there would be for any drug. But we don't know for sure that ivermectin can be used in humans to treat COVID-19. Maybe it will be used, but we don't know that yet. In fact, people started to jump all over ivermectin, and the FDA issued an announcement about the importance of not using ivermectin to treat COVID-19. And people were actually getting this stuff from their veterinarians and using it on themselves because it's also approved for veterinary use. Also in April, from Japan, we had from the Journal of Antibiotics another review article, Ivermectin, a systematic review from antiviral effects to COVID-19 complementary regimen. What this article says is that we don't know yet how useful and how ivermectin can be used to treat COVID-19. Folks, we are in the middle of a pandemic. Do not forget the basic things: distancing, proper masking, and sanitation. Just yesterday, the CDC put out a little guide about face masks. Believe it or not, 8 months into this, we're still talking about face masks. One of the things that the CDC mentioned is that we shouldn't use these little guys, N95s, which you've seen me talk about many times, I think, because these are reserved for medical professionals. I disagree. You know I disagree if you've been watching these videos. This is the only mask that will protect the person wearing a mask from getting COVID-19. Cloth masks do not do that. Surgical masks do not do that well. All right, so I'm going to leave you guys with a word of encouragement because I haven't given you guys a word of encouragement for a long time. So today we're going to take a little reading out of the ancient wisdom of the Bible, the Holy Scriptures. I am a Christian, so for me these are the Holy Scriptures. And this one comes out of Psalm 46. It's a little lengthy. Don't go away. Listen sharply, because it talks about how God is our refuge in times of trouble, and it also talks about how God allows certain bad things to happen, but is there in our rescue. And this is straight from Psalm 46, verse 1. God is our refuge and strength, always ready to help in times of trouble. So we will not fear when earthquakes come and the mountains crumble to the sea. Let the oceans roar and foam. Let the mountains tremble as the waters surge. A river brings joy to the city of our God, the sacred home of the Most High. God dwells in that city, and it cannot be destroyed. From the very break of day, God will protect it. The nations are in chaos, and their kingdoms crumble. God's voice thunders, and the earth melts. The Lord of the heavens' armies are here among us. The God of Israel is our fortress. Come see the glorious works of the Lord. See how he brings destruction upon the world and causes wars to end throughout the earth. He breaks the bow and snaps the spear. He burns the shields with fire. Be still and know that I am God. I will be honored by every nation. I will be honored throughout the world. If you are not a person of faith, take courage and strength that better times will come. If you are a person of faith, let these scriptures encourage you, because at some point we will overcome this illness with God's help. We use our minds, we use our science, we use the natural talents that we have given, but there is something bigger than all of that, and I strongly believe in it. Hey, thanks for listening. If you liked us, give us a thumbs up. Subscribe if you haven't subscribed. Share the video with friends. We'll be back with more stuff about COVID next time. In the meantime, you stay safe.